Recently, there's been a fair amount of discussion in the media about the concept of condominiumizing an ASC. And essentially what they mean by that is separating the ASC temporally among two legal entities, say ASC-A and ASC-B. ASC-A might operate on Monday, Wednesday, and Friday. ASC-B might operate on Tuesday and Thursday. The two entities actually have to function on a completely separate basis, and that means they have to have their own medical records, they have to have their own policy and procedure manuals, their equipment has to be segregated, their drug formulary has to be separate. They're essentially two separate, independently functioning entities that just happen to operate in the same physical space. There are potential benefits, and principally they relate to the fact that surgery centers are like a small hospital, and it's extremely expensive space to build. The physical plant of most ambulatory surgery centers functions at a pretty low utilization rate, meaning it's only functioning a relatively small percentage of the available hours. Even looking at a 40-hour week, many ASCs are only being utilized as surgery centers from 20 to 40% of the time. So there's a lot of air that can be used and sold to somebody else. Anybody that has an interest in learning more about the concept or thinks they may be in a situation where it may be applicable to them, we'd be happy to talk with them, talk through the pluses and minuses and the requirements, and do anything we can to assist as they evaluate that opportunity.